Hi, and thank you for tuning in to watch this presentation about our Live Well San Diego support team's work with community data and analytics. My name is Jeff Jimenez, and I'm the Community Data and Analytics Lead and Data Team Manager.
And I'm Miriam Maldonado, a Management Fellow from the 2022-2023 cohort assigned to the Office of Strategy and Innovation. This presentation will briefly discuss the Live Well Top 10 and expanded indicators measured across San Diego County residents. The Live Well indicators capture the collective impact of programs to improve quality of life so that San Diego County residents can be healthy, safe, and thriving. Thanks again for listening to our presentation, and if you're watching our pre-conference live, please feel free to type in a question within the chat box and we'll do our best to provide an answer. I'll pass it back to you, Jeff, to start the discussion.
Thanks, Miriam. The top 10 Live Well San Diego indicators define what it means to live well in San Diego. Measured across the lifespan among all residents, the Live Well San Diego indicators capture the collective impact of programs, services, and interventions provided by government and community partners striving to improve quality of life. In 2013, the County of San Diego launched these top 10 indicators. In the previous years, our program developers focused on key guiding principles for selecting these indicators. Live Well San Diego is about a collective effort to achieve a collective impact. We wanted to drive us towards research, evidence-based practice, and data-driven results for the most significant impact and return on investment.
The indicators are divided into the 5 areas of influence, a framework that the county developed that is essential for overall well-being, health, knowledge, standard of living, community, and social. We've defined each area: health by enjoying good health and expecting to live a full life, knowledge by learning throughout the lifespan, standard of living by having enough resources for a quality life, community by living in a clean and safe neighborhood, and finally, we define social by helping each other to live well.
The Live Well San Diego initiative is a collective effort involving every sector and every resident. That's why our model of change is one in which everyone does what they do best, intending to impact these areas of influence and consequently achieving the results we seek as captured through the top 10 indicators.
So why measure life expectancy? Our life expectancy indicator measures the average number of years a baby born today is expected to live. We'd like to see this indicator trend upward as it demonstrates the capability to live a long and healthy life. We have 2 expanded indicators in this section. The first includes the percentage of the population that exercised greater than 2 hours a week. The second tracks the percentage of the population that smoked cigarettes in the last 12 months. So why measure quality of life? Our quality of life indicator measures the percentage of the population sufficiently healthy to live independently. We'd like to see this indicator trend upward. As in other Western countries, those aged 65 and older are the fastest growing portion of the population. People are now living longer lives, and the ability to live independently is one of the indicators, when measured over time, that can assess whether there is an increase or reduction in disability or interdependence in the population. Our listed expanded indicator for quality of life includes monitoring those without self-care difficulties.
Our life expectancy and improved quality of life indicators fall within the health area of influence. What can we do to improve life expectancy and improve quality of life? The following actions may contribute to a positive impact on enjoying good health and expecting to live a full life. Implement worksite programs intended to improve diet and physical activity behaviors. Support policies that improve the ability of healthier food and beverage choices. Reduction of tobacco use and secondhand smoke exposure. Improving mental health and addressing mental illness. And lastly, enhancing access to places for physical activity.
So why measure education? Our education indicator measures the percentage of the population aged 25 and older with at least a high school diploma or equivalent. We'd like to see this indicator trend upward. Education is a foundation for building a better future for ourselves and contributes to improving the overall quality of life in our communities. The positive association between health and education has been well established. Education has a beneficial influence on various economic, social, and psychological factors, which impact the health and well-being of a population. We have 3 expanded indicators in this section. People aged 25 and older with less than a bachelor's, high school diploma, or equivalent. People who are aged 25 and older with a bachelor's, graduate, or professional degree. And finally, school enrollment aged 3 to 24 years old.
High educational attainment is associated with the following: lower rates of infectious diseases, as well as lower rates of many chronic non-infectious diseases, greater survival when sick, and longer life expectancy, and higher rate of employment.
Why measure the unemployment rate? Our unemployment indicator measures the percentage of the unemployed civilian labor force. We'd like to see this indicator trend downward. The rate of unemployment has a strong negative influence on the financial health and overall well-being of the population. It reflects a community's overall economic situation and provides information about the percentage of the population at risk for various health concerns associated with unemployment. Unemployment is linked to an increase in risk of work health outcomes, unhealthy behaviors related to alcohol and tobacco consumption, and diet and exercise increase. The rising number of young people connected to neither education nor the labor market is of particular concern. Because employer-sponsored health insurance is the most common source of health insurance coverage, unemployment can also limit access to health care. Our income indicator measures the percentage of the population spending less than a third of their income on housing. We'd like to see this indicator trend upward. When more households spend less of their income on housing, overall well-being improves. This indicator provides information about our community's ability to afford basic needs, and the conventional public policy indicator of housing affordability in the United States is the percentage of income spent on housing. Sufficient income to cover basic living costs positively influences the overall financial health and well-being of the community. High housing costs are associated with poor health outcomes, especially in children. Poor financial health can often lead to diminished physical health, including higher blood pressure and depression. Together, we can help change these statistics and improve the financial health of our communities. Expanded indicators here include per capita income, median household income, people with a checking or savings account, and people with retirement savings.
In a report published by the former Surgeon General, Jerome Adams, employment provides not only essential material resources, but also considerable benefits for an individual and community health. In turn, community health and wellness leads to increased opportunities for employment and prosperity, both for individuals and the communities in which they live.
So now, why measure overall crime? Our security indicator measures the number of crimes per 100,000 people, including violence and property, that are reported to law enforcement. We'd like to see this indicator trend downward. Crime can significantly impact the population's well-being and contributes to premature death and disability, poor mental health, and loss of productivity. Exposure to crime and violence has been shown to increase adverse health effects. We have 3 expanded indicators in this section. The first includes unintentional injuries, the second tracks violent crime, and the third tracks property crime. Now, why measure air quality? Our physical environment indicator measures the percentage of days that air quality was rated as unhealthy for a sensitive population. We'd like to see this indicator trend downward. Poor air quality can be particularly detrimental to vulnerable populations. The relationship between elevated air pollution, particularly fine particulate matter and ozone, and compromised health has been well documented. Negative consequences of ambient air pollution include decreased lung function, chronic bronchitis, asthma, and other adverse pulmonary effects. We have 3 expanded indicators in the section. The first includes recycling, the second reflects ozone design value, and the third tracks particulate matter, also known as PM 2.5. So why measure the built environment? Our built environment indicator measures the percent of the population living within a quarter mile of a park or community space. We'd like to see this indicator trend upward. Access to community spaces is an important measurement for helping our region to achieve the Livable San Diego vision. The Livable San Diego Indicator Steering Committee defines community space as any open space or built structure that encourages the public to engage in healthy physical activity and gets people out of their cars and out and about. Livable San Diego's built environment indicator sets the ideal distance as 1/4 of a mile, which is a 5 to 10 minute walk from one's home with a reasonably walkable route to the community space. We have 5 expanded indicators that are in this section. The first includes recreational facilities. The second and third reflect average travel time to work and commuting over 60 or more minutes. The fourth tracks public transportation, and the fifth tracks access to community space.
Think about how long it takes to walk to your neighborhood's nearest park or community space. Can you walk through a safe area with sidewalks, or is it up a steep hill along a busy street? Factors like this can affect how accessible parks or other community areas are to you and your neighbors. Studies show that it can influence your community's overall quality of life.
So why measure food insecurity? Our vulnerable populations indicator measures the percentage of the population with an income of 200% of the federal poverty level or less who have experienced food insecurity. We'd like to see this indicator trend downward. The inability to afford enough food regularly, including access to healthier foods, essential for good nutrition, impacts the health and well-being of the population. We have 5 expanded indicators in this section. The first includes self-care difficulty. The second reflects primary caregiver or caretaker assistance. The third tracks the lack of health insurance. The fourth tracks linguistic isolation. And the fifth looks at internet access. Now, why measure volunteering? Our 10th and final indicator is community involvement, and this indicator measures the percentage of the population who volunteer. We'd like to see this indicator trend upward. Volunteering is important for numerous reasons that benefit both the community and the volunteer and creates a meaningful, positive impact on the community. Volunteering can help the physical and mental health of the population and create a more interconnected community. Those who volunteer have lower mortality rates, greater functional ability, and lower rates of depression later in life than those who do not volunteer. One set of expanded indicators includes contributing to charitable, political, educational, environmental, health, religious, arts and cultural, or social services organizations. The second set includes whether or not someone voted in an election.
What can we do about food insecurity? Increasing participation in after-school at-risk meal programs by targeting sponsors that are already enrolled in nutrition assistance programs, such as school districts, can expand the reach to vulnerable children. Another strategy is to partner with food banks advocacy organizations, and affiliated community organizations such as Boys and Girls Club to raise awareness. Home-delivered meal programs for low-care seniors ensure daily meals and healthier alternatives for snacks to supplement meals. Community gardens help promote physical and mental health and economic and family health benefits, primarily because the families often work in their gardens together. A community gardening program can reduce food insecurity, improve dietary intake, and strengthen family relationships. Our top 10 expanded indicators use various data, and here are a few agencies where we source those data sets. We've listed the web address on this slide, and if you take a look at the arrow on the upper right, there's a drop-down within the navigation bar to help connect you with our county's data portal. The indicator data and much more publicly available data sets can be found at the county's data portal. The portal provides easy access to open data and information about your county government. We encourage the use of public data published by the County of San Diego to spark innovation, promote public collaboration, increase government transparency, and inform decision-making.
The Community Health Statistics Unit provides health statistics that describe health behaviors, diseases, and injuries for specific populations, in addition to health trends and comparisons to national targets. To learn more, our Public Health Services team recorded a presentation that thoroughly covers the offered reports and dashboards. If you're looking to find ways to aid in effective decision-making and help to identify opportunities for preventative efforts through data reporting, visualization, and predictive analytics, take a moment to view that presentation. It can be located on the Livewell Advanced website and will be posted on our Livewell San Diego YouTube channel. Thank you again for listening to our presentation on community data and analytics. We hope that you enjoy your time learning more during this virtual pre-conference and in person at our Livewell Advanced. If you have any questions, please email us at the address listed on the slide. Thank you.